Take a deep breath. As you inhale, think of the oxygen getting to every muscle, every organ, every tissue, and every cell of your body. Great feeling, right? If you can do this easily, it is because you have healthy lungs. Where the air sacs in the lungs fill up with air, then this air is released quickly. Consider yourself fortunate for being able to breathe without any difficulty. Patients with COPD are short of breath most of the time and even require continuous use of oxygen. So what is COPD? COPD stands for chronic obstructive pulmonary disease. It is a lung disease that only gets worse with time. And today I will explain a little about the causes, risk factors, symptoms, and treatments of COPD. There are two main conditions that make up COPD. One is emphysema, and the second one is chronic bronchitis. In emphysema, there is damage of the lung air sacs. These air sacs lose their elasticity, making the exchange of oxygen more difficult to happen. Thus, there is less airflow in and out of the lungs. With bronchitis, there is irritation and inflammation of the airways. The airways produce a lot of mucus, way more than usual. And this can even clog up the airways. I do want to point out that most patients with COPD have both emphysema and chronic bronchitis. So this is a healthy lung, and this is a lung with COPD. You can see the air sacs in a healthy lung versus air sacs with patients with COPD. According to the National Heart, Lung, and Blood Institute, common signs and symptoms of COPD include chronic cough with a lot of mucus production, shortness of breath, wheezing, fatigue, chest tightness, swelling of the lower extremities, pallor, which is an unhealthy pale appearance according to dictionary.com. And in flare-ups or severe cases, patients can also have a bluish color to the skin due to the lack of oxygen, and even have altered level of consciousness due to the lack of oxygen to the brain. Patients with COPD are also more prone to recurrent respiratory infections, like the flu. Causes and risk factors of COPD include smoking, long-term exposures to lung irritants like pollution, chemical fumes, dust, and secondhand smoke, uncontrolled asthma, and genetic conditions. Even though not as common, it can also be a cause of COPD. Treatments can include lifestyle changes, like avoid or stop smoking, avoid lung irritants, good nutrition, consider vitamins and supplements, medications that can include bronchodilators, steroids, flu shot, pneumonia vaccines, oxygen use, surgery, and in some cases, even lung transplants. To conclude, you should know that as of now, there is no cure for COPD, but with early diagnosis, proper treatment, and lifestyle changes, the progress of COPD can slow down and improve the quality of life of a patient. If you or a loved one has COPD, you should seek medical advice and follow the doctor's instructions, get the support of the family and friends, and know that it is possible to live many, many years with COPD disease. To learn more, visit the COPD. Learn more, breathe better at http://copd.nhlbi.nih.gov.